Hey guys, Dr. Jordan Miller here with Integrated Health Solutions, and today's video is going to be focused on diaphragmatic breathing. Now, most of us, if I ask you to give me a big breath in, we're usually going to revolt to our chest, right? We're going to breathe up top. Well, if you have any kids or if you spend any time around young children, you can see that when they're breathing or when they take their first breath, more evidently, we're using our stomach. Right? Nobody teaches them how to do that. It's not a learned behavior. It's something that you're born knowing how to do and something that we actually get away from the older that we get. Now, it's something I go over with almost all my patients because it's very important for just day-to-day function. When you're breathing in and you're using your chest, you're doing two things a little bit incorrectly. Number one, you're recruiting the strength and tension from these muscles in the upper portion of the shoulders and the neck. These are the muscles that attach to the upper rib cage. And every time you breathe in and you elevate the rib cage, these are the muscles that you're using. Right? So every single time that you're taking a big chest breath in, you're creating more tightness and tension on the neck and shoulders. And number two, every time that you elevate and you lift up that chest to breathe, you're also curving your back and you're putting yourself into extension, which means that you're putting your core at a little bit of a harder opportunity for it to be used. So you're doing two things, not only for the upper, but for the lower back, that kind of slow down your progress and ability to function normally on a day-to-day basis. So this is a great exercise that I go over with almost all my patients to really just instigate that diaphragmatic breathing, which helps you then instigate your core pressure. So ideally what we're gonna do is we're gonna find a flat surface, preferably not a bed or a couch, something that's really, really squishy. So if you have a firm table or if you have a yoga mat or some blankets you don't mind laying on the floor, all you're gonna do is you're gonna get down into a position where you're flat on your back. You're gonna elevate both of your knees, because when you elevate your knees, you tilt the hips backwards a little bit, which makes it easier for you to flatten out your spine. If you straighten your legs, you're gonna anteriorly tilt the pelvis. You're going to lift up the lower back a little bit, which is going to do almost the same thing as lifting up and extending the chest. So always keep the knees bent, lifted up towards the ceiling. One hand you're going to put on your upper chest, one hand on your lower stomach. Now, as we're breathing, we always want to breathe in through the nose and out through the mouth. When we are breathing in through the nose, with your lower hand on your stomach, use your fingertips to apply just a little bit of pressure up against the stomach. This will create some resistance and some negative pressure so that as your body breathes in and inhales, it makes it a little bit easier for you to feel that pressure and expand and push out against your hand. And then as you exhale out through the mouth, feel that depress again as we breathe in and out. Now, it sounds simple, but I guarantee you this is an exercise that almost all of my patients struggle with, but it needs to be done repetitively, right? This is not a, let me try it once a day and just hope that my body picks it up. It is a muscle memory that needs to be reactivated as consistently as possible. And when we are able to reactivate that diaphragmatic breathing and bracing, not only are we relieving tension on the lower back and the upper body, but we're setting up the core for success and we're allowing our body to be used a little bit more functionally. So ultimately 2, maybe 3 times a day, give me 45 to 60 seconds of a flat on your back position, practicing breathing in and breathing out solely using the stomach. You will certainly thank yourself in the future. Until next time, guys.